Hi, everybody. Thank you so much for tuning in this evening if you are here, and thanks for watching the recording if you're watching the recording. My name's Kat the Vet, and I am here with Kieran Borgeat, one of the leading veterinary cardiologists in the world and certainly in the UK. He works at Bristol Vet School as their cardiology lead. That's right, isn't it?
That's correct, yeah.
Which is where we both trained quite
many moons ago.
We won't mention that. And I've asked Kieran to join me this evening to talk about dogs with heart murmurs, and when it can be a really scary thing if you go to the vet and the vet says, oh, I can hear a heart murmur. And I think a lot of thoughts run through your head at that point. What's a heart murmur? What does that mean? And there is always that thought, is my dog going to die? And we don't really want to vocalize that, but I think it's something that goes through a lot of people's heads when vets start to talk about things like that. And I think it's really important.
People worry, don't they, and don't express that to their vet necessarily, and then maybe down the line it kind of comes out,
Exactly.
Yeah.
We're sponsored this evening by Bowringer. Thank you very much, Bowringer, and their Beat website, which is beatdogheartdisease.com, and that is a website full of advice, the sort of thing we're going to talk about here. I will link it below after we're done. Head on over there and have a little read. It again, it goes through all the things about what's a murmur, when should you worry, what sort of dogs have them, and all that kind of thing. So thanks ever so much for the sponsorship, but let's get cracking. So Kieran, let's start with something really basic. What is a heart murmur? What does it mean?
So a heart murmur is one of those things where a lot of people know the term, but I think they don't necessarily understand what the vet's talking about specifically. So a heart murmur is an abnormal sound when you listen to the heart with the stethoscope. Very, very rarely you can hear a murmur just with your ear, or sometimes you can even hear it if you're just sitting next to the dog.
That would be a pretty big one, though.
That's a pretty big one. Yeah, my loudest I ever heard was in a Labrador whose owners had called the plumbers, because when the dog's bed was near the pipes, and the dog lay on the pipes, and there was this noise that sort of radiated up the pipes, and they called the plumbers, and the plumbers twice had said, "There's nothing wrong here with the pipes," and then they realised it was coming from the dog, not the pipes. So that's very, very rare. Most of the time it needs a stethoscope to hear the murmur. So vets in the clinic will have a listen as part of the routine puppy checks, as part of the annual health checks that are carried out. And the sound through the stethoscope, the heart sounds are amplified. And normally the heart sounds like a lubbed up of, the valves closing in two different parts of the heart. And most heart murmurs that we hear as vets are in between those two sounds. And it's a sort of whooshing sound. You have to forgive the impression. I've done this before. It's a lub-shtup sound. And it's that additional noise that we talk about as a heart murmur. And many vets will also grade the heart murmur. So we'll tell an owner, oh, it's a 3 out of 6 or a 4 out of 6 or a 1. And this is how loud the heart murmur is relative to the heart sounds. So a 3 is the same volume as the heart sounds. A 1 and 2 are quieter. 1 is very hard to hear. 4, 5, 6 are louder than the heart sounds. And a 6 is where you can hear it without needing a stethoscope if you just have your ear close to the dog's chest.
You can sometimes feel it with a 6 as well. You can feel the sort of thrill against the fizz. It's like a fizzing on the chest.
That's right.
Most dogs, certainly in my experience in first opinion practice of seeing pets coming in and out for their annual vaccinations and checkups and things like that, is we will pick up a heart murmur very often in sort of middle age. So I would say that the time is generally around about 3-4 years old, sometimes a bit younger, sometimes a bit older, but generally they're adult dogs. Puppies can have heart murmurs. We should probably mention this now. So puppies can have heart murmurs, and they're often diagnosed at the first checkup ever. But that's not what we're discussing today. That is a whole other subject that maybe we'll get around to one day. But what we're talking about today is adult dogs who are completely normal. You've not thought that there's anything wrong. You've taken them in for their annual checkup. The vet has put the stethoscope on the chest like we do, part of the check. And we say to you, oh, I can hear a heart murmur. And I think a lot of people then get a bit stressed. So yeah, so heart murmurs they're leaky valves, aren't they? So that shushing noise is coming from leaky valves, and there's various different valves in the heart. And so I always describe the heart. Well, obviously the heart is a pump. I don't describe it as a pump. It is a pump. The heart is a pump around the body, and blood comes from the body into the heart. It's then pumped out into the lungs, where it picks up all the oxygen. Then it goes back into the heart from the lungs, and then it's pumped all the way around the body. And that oxygen feeds the body and the system, doesn't it?
That's true.
But it's really important that blood keeps moving forward through the heart. And what the leaky valves do is you get some blood coming back, don't you? And that's the swooshing sound. Some people describe it as if you've put your finger over the end of a hose pipe. Some people describe it as like an eddy in a stream. I often use that one. Is that right? That
I quite like the sort of hose pipe noise. We see murmurs, as you say. You get a lot of murmurs in puppies. That is a whole separate subject. Most murmurs in puppies can be ignored effectively if they're quiet. If they're as loud as the heart sounds, that merits taking seriously. In older dogs, middle-aged and older dogs, we see them developing these heart diseases, which are probably genetic, but they come on in life. They develop later in life, so that the coding is there at birth. But the actual problem with the valve or with the heart muscle occurs in middle age normally. So I think we see a lot of age 3-4-year-old dogs, as you say. I think the average age of the dog that I see with heart disease probably is 7, 8, 9, something like that. So maybe a little bit older. And the majority of the murmurs are caused by a leaking valve. And the largest valve or the most common murmur rather that we see is called a mitral murmur. And almost all the murmurs that we see with heart disease that's adult onset are localized to the mitral valve. And because it's on the left side of the heart, which is the biggest pump, as you say, that pumps off around the body into that circulation, it's often a sort of medium to loud murmur. And that's a really important murmur to take seriously and to understand when to monitor, when to investigate, and what to do about that.
Yeah. And that's the point, isn't it? Is that when the vet says your dog has a heart murmur, that doesn't mean that your dog has heart failure, does it? There's a big difference, because the hearts can totally cope with murmurs. The heart has a huge reserve capacity. I describe the heart murmur as being less efficient. So a heart without a murmur sends 100% of the blood forward into the body, feeding the body with oxygen. A heart with a heart murmur, some of that blood goes the wrong way and it leaks backwards rather than going forwards.
Absolutely,
so the heart is putting out less oxygen, but it can cope with that. The body can cope with that. The heart can compensate for that. So having a heart murmur does not mean your dog has heart failure, but it does mean they're more likely to get heart failure. So it's not a given anyway, is it? But it does mean they're more likely to get heart failure.
No, I think that the important thing is that, for me, is that heart murmurs, as you say, are super common. And actually looking at some of the research that's out there following dogs with heart murmurs over years and years and seeing what happens to them, more than half of dogs with a heart murmur never develop any signs and never require any treatment for heart failure. So it's very, very different. If a vet detects a heart murmur, it's not a death sentence, first of all. You've got a better than evens chance your dog's going to be fine. But there are a proportion of those dogs with a heart murmur who do progress, and it does become a problem for them. And those are the ones that it's a little bit more difficult to tease out just in the consultation who they might be. So there are certain things that we can look at to try and identify who's a higher risk dog.
Exactly, like breed, isn't it? So
yes, breed is important. It's true.
Yeah. So the Cavalier King Charles Spaniel is our top, I would suggest, heart dog. Huge genetic.
Yeah, it is. In the US, I think it's a little different genetically. So in the USA, maybe the Cavaliers, the miniature Dachshund is a really common breed affected by heart valve disease, and the Norfolk Terrier as well, are really big breeds in the USA. In the UK, I mean, the Cavalier is the poster child. Unfortunately, they're sweet dogs. I know so many cardiologists with Cavaliers. I'd have one if my wife allowed me. And they unfortunately do very commonly develop a disease called mitral valve disease, which is a sort of degenerative problem of that mitral valve. And in Cavaliers, there are some studies which suggest that dogs at 10 years old are all affected to a degree by mitral valve disease. Now, that may be a very, very minor degree. Again, maybe doesn't even have a murmur at that point, because I know 12, 14-year-old dogs in the breed who have no murmur, but it's a big problem within that breed. So certainly we know that they get it a lot, and also when they get it, they seem to progress a little faster than other breeds. So we definitely take breed into account in our assessment.
Yeah. If you've got a Cavi, expect it at some point. I often, if I see a Cavi who's a bit older, if I see a 6 or 7-year-old Cavi without a murmur, it's always something I go, woo, we don't. It's amazing.
Good news at that age, absolutely.
Yeah, which is kind of sad. So we've come into the vets with our 7-year-old Cavalier King Charles Spaniel, and I have said to them, I can hear a murmur. It's a grade 2 or 3, which is very average. We grade murmurs out of 6, with 1 being the quietest and 6 being the loudest. And very often we're diagnosing these murmurs when they're kind of middle of the road. But that doesn't mean that the dog has heart failure, does it? And so, first of all, is there anything owners can do to slow the onset of heart failure? Is there anything they can do? Because it is a progressive condition, isn't it? And in a lot of breeds, particularly these predisposed ones like our little Cavies, like you say, it isn't completely ordained in their future, but it is quite highly. And at some point or other, that heart murmur will progress to heart failure, but you're probably not there yet. Is there anything we can do at this point with our, grade 2 murmur, but very well dog running around in the park, chasing the ball, showing absolutely no signs of a problem? Is there anything owners can do to keep the dogs healthy at that stage? So
I think, first of all, just to clarify what we mean by heart failure, I think is pretty important. And when we're talking about these valve diseases that we see, and also heart muscle diseases, generally the sign of heart failure is fluid accumulation somewhere in the body, caused by the sort of failing pump, if you like. And as you say, that the heart has a huge reserve, thank goodness, because otherwise we'd all be in trouble. So we're highly evolved to have this great cardiovascular reserve that kicks in when there's a leak in the valve. Maybe 20, 30, 40% of the blood that should be going forwards is actually going backwards, against the sort of flow that should be happening. And in those cases, obviously you get a drop in the forward flow of blood, but they're fine. They cope well. Various mechanisms kick in, and over time, those mechanisms lead to fluid accumulation. And the main place that we see that is fluid developing in the lungs themselves. So that the first signs that we see of heart failure in the vast majority of dogs is an increase in breathing rate and an increase in breathing effort. They may also reduce their exercise tolerance. So they may not, generally they want to go for walks because the mind is still willing, but the body's not able. They still want to go out and run, and they want to chase a ball, but then they come back, they stay close to their owners. Maybe they take a longer time to recover from the period of exercise. So these are the signs that we tend to identify early on in heart failure. And eventually, if it was left unchecked or hadn't been noticed, or just happened particularly quickly, because sometimes they do, you can end up in it with a dog who's got real breathing difficulty. So those are the signs that we look for to call it heart failure. So if you have a dog with a heart murmur, even if the vet's saying, oh, it's a 4 or a 5 in terms of grade, well, if the breathing rate is normal, the dog is not in heart failure. So that's super important. In terms of the progression, we think about mitral valve disease, which is the biggest one. It affects probably 75% of all the dogs with heart disease that we see. So it's a really important disease, super common. And with mitral valve disease, what happens is when they get a heart murmur, we would put them in what we call stage B of heart disease. Now, stage B is there's no signs. There's no breathing difficulty. They're exercising well. There's nothing outwardly that would tell you there's an issue with the dog at all, except for that heart murmur that the vet hears with the stethoscope. The stage B can then progress over time in a smaller proportion of dogs, less than half of dogs. They progress, the heart enlarges and struggles to cope so much.
Let's see, while you're chatting about that, because we were talking about this earlier, whether I can share my screen. I don't actually know how to do that, though.
Shall I give it a go? I have a diagram here.
Go on, you give it a go, because I feel like you're better at this than I am. You do more talking.
No idea. Oh, apparently I have to do something with my system preferences. How exciting. Okay, fine. So I think, I don't know if you can see this yet. Can you see the diagram yet?
No, I can't.
Okay, I'm not going to be able to share it because I had to restart my browser to do that, I'm afraid. I don't know if you can do it from where you are.
Well, I don't know why it won't let me put, oh, look, it's made you small. Ha!
There we go.
No, then you're big.
So if not, let me just describe it. And if you're able to do it, that's fantastic. But we think of heart disease as having a progress through stages A to D. So A, B, C, D. Stage A of heart disease is just a dog who is at risk. So this is where the breed comes in for us. We don't have any good genetic tests or anything for this disease yet, although I have colleagues who are working on that side of things. And there's some, clearly there will be genes in there that should be testable. But at the moment, the best thing we have is the breed. The second thing we may have is family history. And that's important because if you have a crossbred dog, say, so we don't have a pedigree breed to say, oh, well, they are higher risk or lower risk or whatever. But that, say, a family member or a close friend bred the dog and they said, oh, well, yeah, his father had heart failure. Okay, well, that's an important thing. So it's always worth thinking about the history of the family if you know it. If it's a dog from a rescue center or a friend of a friend or something, we haven't got access to that, then of course we can't add that in.
But you can make some assumptions, can't you, with some of the breeds, like the cavies and things and the
I think cavies, generally smaller breed dogs, we say less than 15 kilos in body weight, terrier breeds, that they are all potentially affected by mitral valve disease. Spaniels are a higher risk, especially the Cavalier. We see the Norfolk Terrier, the miniature Dachshund, as I say, but we also see some larger dogs, like the Border Collie is a breed that gets mitral valve disease, and also sometimes German Shepherd dogs and Labradors as well. So it's not all the small dogs that get it. Sometimes it is the larger breeds too. So, a Cavalier when they're born is stage A of heart disease. It doesn't mean they have anything wrong. Doesn't mean they have a murmur. It just means they're at risk genetically. Stage B of heart disease is when we've got a murmur. And that's important because stage B is the time when your vets may hear the heart murmur and may say, okay, well, we've got a heart murmur there. It wasn't there last year or the year before, and it wasn't there as a puppy. So this is a new thing. That would put a small breed dog most likely in stage B of mitral valve disease. Stage C is clinical signs. So this is the symptoms of breathlessness, difficulty breathing, prolonged recovery from exercise, potentially coughing. So these are signs that we see in stage C, the clinical, overt, obvious disease. And then as that progresses, that they're in stage D, which means that they're not responding as well to medical treatment that we would prescribe for them. So those are the cases that unfortunately are much more advanced and we'll need to see the vet more often. And at some point, this is a disease that either requires surgical repair of the valve, which is very, very limited. There are 2 or 3 centers worldwide that are doing that at the moment.
I didn't even realize that was an option, to be honest.
It is a thing. It's a challenge in part because of accessibility, finding a surgeon who can do it and do it well with a good track record. You don't just want someone giving it a go. It's something that requires a super experience.
Laid out for that one. Absolutely not.
Yeah. have a good cup of coffee before that one. I think finding an experienced, able centre with a proven track record is challenging, but also it's very expensive to have that done because of the fact that it requires such a team of people to do it and such specialist equipment. So we're talking about somewhere between 17,000 and in the USA and in Japan, £35,000. So it's a massive amount of money, and it's not a realistic option for the vast majority of people. I mean, it certainly wouldn't be for me. So unfortunately, dogs who go into stage D of the disease, where they're not responding so well anymore, it ends up in a very difficult conversation with owners, whereby, you know, these dogs become breathless and we can't control it. So the fairest thing to do, sadly, is to put them to sleep at that point. Now,
so they often do die of their heart disease, but there's a huge journey to go through before we get there.
Yeah, and that stage B is very important on that journey, because the stage B is, you know, we've said that dogs can have a murmur and they're just fine, and, you know, live a normal lifespan, and then some go to stage C. Well, actually, to reflect that, cardiologists divide stage B into B1 and B2. So there's a progress line within stage B, and the whole time in stage B, dogs don't show signs. So what we need to do is we need to know where they are in stage B to try and identify if there is risk there of progressing to stage C. The important thing there is not just our knowledge of is there risk, but actually we know from really nice scientific studies that if we can treat them with a particular drug in stage B2, which is where they've got no signs but they've got a large heart, that does slow the progression of the disease before they develop signs. And not just by a small amount, you know, not just a few weeks. We're talking about the average dog living a year, well, more than a year longer with no signs of disease and no requirement for medical treatment. So it's super important for us to identify who's who in that stage B. And
that's the crux. That's the crux of the matter, isn't it? Is we can get to these dogs early and we can help them live a longer life. And a whole year of life, of good quality, extra life.
Good quality is the important thing there.
Absolutely phenomenal. So how do we identify those dogs that would be the ones that, well, it's interesting that you said the heart is bigger, because the other way that I often describe it to my clients is the heart is a muscle. And when the heart and the heart that's less efficient, with this blood leaking through those valves and going back and not pushing as much blood out into the rest of the body, that heart is having to work harder to do the same job, isn't it? Because it's less efficient, and a muscle that works harder gets bigger.
It's true, yeah.
But there comes a point when the heart gets too big and it no longer is functioning well. That muscle just gets too big and it's not strong, is it?
Absolutely. The way that I think of it is, as it becomes bigger, it becomes sort of less efficient, less effective. So although you've maybe got more heart, if you like, more muscle, it's not doing as much of a good job pound for pound. It's less efficient, and therefore it doesn't work so well. It uses more oxygen. It gets scar tissue deposited in it. It becomes a real mess.
It's working harder, not smarter.
Harder, not smarter. Yeah.
So well, I have two questions for you now. Okay. One, how would a vet pick that up, and what might you expect your vet to say to you at that point? But how would an owner pick that up? You know, we're going to listen to let's start with the owner, because, you know, we walk in, we find this grade 2 or 3 heart murmur at an annual vaccination. We then say, watch them for breathlessness or reduction in exercise tolerance and that sort of thing. But they're quite major signs, I think, to pick up on.
Represents a big step. Yeah.
Exactly. Yeah. And our dogs, even our little tiny fluffy cavies, are natural athletes. You know, those 4 legs, they're naturally far fitter, far more capable than we are. So I was really pleased when this extra bit of research came out to say that we can, because what owners can do at home is monitor their breathing rate, can't they? That's the point I'm getting to, is you can watch how they breathe. Yeah. So tell us a bit more about that.
So we always encourage owners to monitor the breathing rate at home. It is, as you say, super important, and it does change quite early with disease. So we ask owners to keep a diary. There are some apps available which will help you track the breathing rate over time, and maybe put a graph. So people can do that over time and monitor what's happening. It's also quite important to get a feel for how to do that as an owner of a dog with a heart murmur when the dog's normal, when the dog's coping and not in heart failure, because then it means you'll detect changes early. You'll be more sensitive to those changes. And we know from various research studies that the breathing rate will trickle up over time and then will spike when they go into heart failure. So that increase when they're resting, ideally done when they're asleep, is the best time to do it, because they're not then sniffing or panting or responding to anybody.
And they spend a lot of time asleep on the sofa, don't they? Cavies or dogs like them. You can find
wherever in your bed, by the fire.
Let's take our cavie.
Mm-hmm.
What is a normal? What would you consider a normal sleeping breathing rate for a Cavalier King Charles Spaniel?
We would say less than 30 is normal. So over 30 is not normal. But many dogs, I think, owners say will call me up and say, "Well, actually, I've been checking it, and you said 30 was a concern, but our dog is 12. That seems quite low to me." Well, actually, that's fine. 12 is fine.
They don't breathe at all, do they? I sometimes, you have that sometimes when you're recovering them from anesthetics, and you're like, especially the old ones, they sleep so still, don't they?
Yeah. So I think as long as they are breathing, you can't be too low for me. But 30 is a sort of magic number. Again, there's some studies out there that suggest 30, anything above 30 is consistent with some fluid in the lungs. So I think the owner monitoring of breathing rate is really important, but that is detecting the early point of heart failure, which misses this crucial point of stage B2, where the heart is large and we can do something actively to slow the progression of disease. So yes, it's very important to detect those dogs when they get heart failure signs, and get them as early as possible is ideal. But the way to detect heart enlargement, which is the difference between B1, where we consider them low risk, and then B2, where they're high risk of progression and therefore benefit from treatment. The way to identify those dogs is through taking either a chest X-ray or a heart scan. And that's something that, every vet in the country, all over the world will be able to take a chest X-ray, even if they haven't got access to ultrasound and experience with scanning hearts, which is quite a niche skill to learn.
I'm a bit, I can do it, but it takes me a while. But yeah,
that's where I started. Yeah.
So as vets, we should, what heart murmur from, for me, at what point should I be suggesting to my clients? At what point maybe should my clients be asking me or their own vet, can we scan his heart? Is it right from detection? Is it grade 3 or above? Is it?
We would go based on grade. So we would say that a grade 1 or 2 is highly unlikely to have an enlarged heart. Is it possible? I mean, it's biology, so there's lots of possibilities, but it's very unlikely. Grade 3 is the magic number here. So grade 3 heart murmurs and louder, we would absolutely advise a scan, especially if it's louder, because actually with the typical diseases like mitral valve disease, the louder the murmur gets, the worse the disease, the more severe the leak in the valve, and the larger the heart is. So generally we would say if it's progressed from a 2 to a 3, that definitely should, suggest a scan. If the vet detects it today and it's a grade 4, that merits a scan or an X-ray or whatever to look at the heart size without having to monitor.
And we can scan them conscious, can't we? But we do have to sedate for X-rays.
Yeah.
Which is something that causes quite a bit of anxiety. If on the one hand we're saying your dog might be in heart failure, but now we're going to knock him out to take an X-ray. But the sedative combinations we can give them are safe, aren't they? Or I would consider them safe. I guess you would agree.
Yes, yeah. I mean, there are combinations that are not safe, and there are combinations that are safe, and vets will know which is which. There are certainly sedative combinations that we don't really want in the same postcode as a dog with a loud heart murmur. But those are ones that are used for the young dogs, for, maybe they've they're lame and there are some x-rays being taken of a joint or something. So they're otherwise healthy dogs. Any vet who has got any experience, knows that dogs with heart murmurs should be given particular combinations of drugs, and they are very safe. We will do it routinely for our chest x-ray dogs, and very rarely we will do it for some dogs who need an ultrasound scan if they're particularly anxious, and clearly it's just going to be a horrific experience for them. Nobody wants that. Sometimes we give them a little sedative for them as well.
And we've had a question come through, actually, which I think is quite perceptive. What about blood tests? Because there are blood tests that can look at the health of the heart. Are they a good way of monitoring it? Have we got the figures for them for the cutoff? Yes, you're going to benefit from meds at this point.
So at the moment, the blood tests that are available, we don't know about what the cutoff would be for the decision to treat or not. There is a research study that they've actually got all the data for now, and they're analysing it. It's a huge international project, which was called Hamlet, because they were trying to decide, is it B2 or not B2? So the Hamlet project.
There's such cards.
Yeah, I know. I know the guy who was running that project, and it's classic humour from him.
I bet he was really proud of himself when he thought of that.
Oh, definitely. So that Hamlet study it's on the horizon, and I don't know if it's going to produce numbers that say at this level of blood test, we call it a pro-BNP blood test. Yeah. If at this level of pro-BNP we treat or not. But if it did, that would be super helpful, and it would help a huge number of dogs who at the moment just maybe can't access chest x-rays or heart scans or whatever. So right now that the blood tests are a little bit of an unknown quantity. There are numbers established which suggest if they're above a certain level, they're more likely to have clinically significant heart disease. So it's more likely to be worse. But that's not a hard and fast number. And we know that with pro-BNP blood tests, there's something like 50% day-to-day variability in dogs. So just because it's a Tuesday, it might be half what it was on Monday. So we need to be a little bit careful about interpreting those. And probably the best way to interpret pro-BNP is to track it over time, much like respiratory rate. But here we're looking at something the heart produces when it's stressed or stretched. That's how I think of this heart hormone, pro-BNP. So that's a potentially useful test. But again, we'd have to take a level where we know the heart is a normal size and check it maybe every 6 months or annually, probably, to see if it's changing. So there is some scientific data out there to show that the rate of change of that pro-BNP is important. And dogs who have a faster rate of change are progressing faster and more likely to go into heart failure. So our advice generally would be that, your dog is detected and has a grade 3 or 4 murmur. You have a heart scan or a chest x-ray, whatever is accessible and straightforward. And it's detected the dog has a normal size heart. Fantastic. Take a pro-BNP, because we know that for this dog, on this day when the heart is normal, it's going to be 800. I don't know, just a number for that dog. And then next year, the dog comes back in for vaccination, has a listen with the stethoscope. Everything sounds the same. Everything's reported to be the same at home. The vet checks the blood test as well while they're in for their vaccination, just as a routine health check thing, routine screen. And this year it comes back higher, but not just 10% higher, because that could just be variability. We would say it has to be 50% higher.
Yeah.
If the dog was 800 on the first appointment, a year later, it would have to be 1,200 for us to say that's a real change. And therefore, there needs to be another scan or another x-ray. What's quite good about that is you might take one x-ray of the dog's chest and a blood test every year, and you may never need to take another chest x-ray if that number on the blood test doesn't increase enough. So we can reduce the amount the dog has to see the vet. We can reduce the amount of money that has to be spent, because these blood tests are generally cheaper than a chest x-ray. And also, they can be done without sedation. So generally, they are a winner, but we need to do a little bit of work at the start to understand what that number means for that individual dog.
Yeah, so there's not one number for everybody. It's more of an individual test. Yeah. But I like that. If we know they're normal on one day, we could maybe use those blood tests to track them. But obviously, we're going to, at the moment, you know, you're going to have to scan and or X-ray to look. We're looking for the size of that heart, and when the heart starts to get big, even if your dog is 100% normal, we know that if we start them on medicine at that point, they will live longer and they will have a better quality of life.
Absolutely true. Yeah.
And how often? So if we scan Fluffy the Cavalier King Charles Spaniel or Schnauzer or Miniature Dachshund or Norfolk Terrier, and it's normal, what point should we? Obviously, we need to keep monitoring the situation, because heart murmurs, heart failure, it's progressive, isn't it? It does. This is a snowball rolling down a hill. It is going to pick up. You know, it is going to get worse. When should we be doing it? Once every 6 months? Should we be doing it annually? At what? How do we pick up that point?
We tend to recommend annual checks, and
which is too onerous, is it? Really?
No, it's not too onerous. And I think the difficult hurdle to get over for a lot of people is, well, he looks fine. You know, he's exercising well. They look okay. Why do we need to bother? And of course, the answer is that they look fine until they're not. And if we only intervene when they show the obvious signs, and that does need to be dealt with for sure, of course. But if we only intervene then, we've sort of missed the boat on a real potential to help them much earlier in the course of their disease. And I think if most people were offered an opportunity to be given a medicine which bought them an extra year, which, let's face it, for many of these dogs is more than 10% of their life. So if someone could offer you, 8-10 years,
thank you. We're going to live to 100.
Yeah, you never know.
Pick a big number. Yeah.
With 2020 being the way it is, it seems unlikely. But I think if we put it in those terms and think about if I was offered an extra 10% of my life, free of any signs, free of breathlessness, you know what? I'd take it. Yeah, absolutely. So my job is to look at things from the dog's point of view, really. And I think, if I was offered that opportunity, I definitely would want to.
And that's really solid research these days, isn't it? This was a massive international, thousands of dog study, so we know. So we've scanned Fluffy. The Cavi, and we do have an enlarged heart, or we've seen it on X-ray that the heart is getting bigger. We're going to start on that medication. It's not, is it, like a metronome is ticking to a year when extra problems will start? So it's that point, isn't it, that home monitoring really comes into its own.
Yeah, it's super important. Once they're in this enlarged heart situation, stage B2, we don't recommend having the blood tests done frequently, because they don't matter as much as breathing rate at home. So respiratory rate monitored by an owner is the most valuable test there. And for me, if the owner's happy with the breathing rate and everything looks good, I don't necessarily repeat chest X-rays to look for heart failure. I will believe that breathing rate. We may want to repeat scans and follow the scan over time to look for various complicating factors, or try and monitor how things are changing so we can keep the owners updated on where we are with things. But we don't necessarily repeat all the tests that we did at the start, because actually that breathing rate is, valuable to us. I think that the other thing is really monitoring the exercise capability, quality of life. And we know that dogs who are given this drug in the stage B2, compared to dogs who were given an identical tablet, which was actually a placebo, didn't have any drug in it at all, but looked the same, it tasted the same, it had the same packaging even, made in the same factories, but no drug in it. And we know that those dogs who were given the drug, actually, their hearts got smaller in the first 3 months, and their quality of life scores by their owner, who didn't know whether they were on a drug or not, the quality of life scores were higher. So we've got proof that the drug also improves quality of life as well as quantity of life.
Which is what it's all about for our pets, isn't it? It's not about how long they live, it's about how they live.
Absolutely.
Which is what is so fantastic. But when So how do we? So we've got our dog who is in this stage where they're on this medicine that's giving them this extra year of life, and I think that's really cool, because this is one point where you guys at home can tell us in the clinic what's happening. We don't have to particularly run masses of extra expensive tests, masses of this isn't an intensive disease. They're not going to be coming in week after week for testing and stuff, are they? We're just going to monitor their breathing at home. And when that breathing tips over 30 breaths a minute, that's when we move in with more medicine. I mean, we talked very briefly about surgery, but 99.9% of the dogs with this disease are just medically managed. This is not a surgical condition.
And successfully medically managed.
Sorry, go on.
And sorry, successfully medically managed. They have a good life for a decent amount of time on the drugs. Yeah. And
we've got a long roster of meds they can go on after that. Some of these little guys do end up rattling a bit, I think, when I send them home with tablets, but they all do a brilliant job, don't they?
Yeah. What's quite nice for me, obviously, being a cardiologist, I don't do anything else apart from manage dogs with heart disease. So I've got a lot of feel for how they respond to the drugs, and a very common concern is the number of medications they're on. And actually, routinely for me, I will put dogs on 3 or 4 tablets when they go into heart failure. So if they're on their Pimobendan, which is this drug, this preclinical safe B2 drug that we know shrinks the heart and helps them, they're already on that, say. The day they go into heart failure, I will add 3 additional drugs. And people say, I'm very worried about them being on 4 drugs. I'm very worried about the interaction of the drugs and the side effects. But these 4 drugs, the reason we do that is because the 4 drugs do very different things. So actually, they are all super important. One of them will help with the function of the heart. One will help get rid of that fluid from the lungs, which is obviously mega important to quality of life. One of the others reduces things like the sort of scar tissue in the heart that forms over time, and also helps potentially the other drugs to work. And the 4th drug does a sort of similar thing. So actually, they work on different parts of the system and help to control things really nicely. And actually, they're synergistic. They help each other rather than causing problems with adverse effects. And we don't see many dogs get side effects of these medications, which is great, because obviously not all drugs are like that. Some drugs will have adverse effects. And I'm quite lucky to work in a discipline, quite grateful to work in a discipline where by giving the drugs, we're really helping them. And we don't see many side effects of things.
No, so they so once we go into heart failure, they do go a bit from 0 to hero, don't they? And suddenly
they do. There's a step up.
Give lots of medication, but I think that's really important. All those meds are really safe. They're all really effective, and we know, don't we, that this quality of life, they're going to do better for longer with all 4 or however many, to give them all is, it is beneficial for the pet, because that's the whole point of this. We're not, they're the most important thing. They're the heart of everything we do, but we know they're going to do better. Do we know that they're going to live longer if we choose that combination straight off the bat?
We do, yes. There's some good data out there suggesting they do live longer on these combination. What I should say is that, obviously that has a monthly cost there, financially. And also there are some dogs, maybe, the owners say, I don't care about the money, but he just hates having tablets. And that's,
he can eat.
Yeah, that's it. It's, there are ways around that, but I do know owners who have really struggled with giving 4 pills. So, for whatever reason, and I think it's really important to say that if that's the case, it's not an all or nothing. It is possible to give 2 of those drugs. The average dog on 2 will probably not live as long as the average dog on 4. But for a period of time, their quality of life will be good and they will respond. So for me, I really don't think heart failure is the end of the road. It's a negative step. It means there's more intensive medication. But most dogs, when they start medication, actually, they do great. It just depends on for how long.
Yeah, I think that's a really good point, is that there are costs and practical considerations that come along with giving animals that amount of medication, and they're not insurmountable. And I think that, you should, vets, even cardiologists like you who see the really specialized cases, we're very used to working with owners. This is a partnership, isn't it? It's a partnership between the dog, between the owner, and between the vet. And I think we've just got to always keep that communication open and be honest with us and tell us what you think and tell us what you're worried about and tell us if you're struggling to afford these medicines or you think that that's going to be beyond you, because we can work it out and we can give the pet a great quality of life. And we don't always have to do exactly what the textbook says to get a good outcome. So we've been chatting for a while, but there's just a couple more things that I really want to cover, which is the next thing is, what about the progression of the disease? So we've done our starting the medication before we've got disease symptoms, and we know that we've done a great job. We've now started on whatever combination of meds is going to work for you and your dog. How do we go for it? Like I say, I describe this as like a snowball rolling down a hill. We can't stop it, but we can slow it down.
Yes.
What are we just going to continue to monitor that breathing rate and that exercise capability? At what point, if we see a down step, what are we doing with the meds then? Are there more than 4, or do we just up the doses, or what do we do then? Yeah,
so it can be quite a journey. And most dogs, when we start them on medical treatment, they do great. Normally, in fact, most dogs don't need hospitalization when they first go into heart failure. Some do, but most dogs don't.
Yeah, I don't admit many. You just go, right, it's time for some more medicine.
Sure, yeah, absolutely. And in a lot of ways, minimizing their stress when they've got fluid in their lungs, as you can imagine, is the best thing to do. So we desperately try and get them out of the hospital as soon as they can, not because we don't like them, but just because we do like them. We want them to be, in their home environment. So if we can stabilize them at home, that's great. And they tend to start on their meds, 2, 3, 4 meds, whatever we're at. After a period of time, one of these medicines is a diuretic. So it makes them get rid of some of that excess fluid from the body, which has been building up in the lungs. So that works on the kidneys, and after a period of some months, the kidneys begin to get resistant to it. Now, the other drugs, they don't tend to get resistant to the other drugs, but this one they do, because the kidneys are really clever. So they sense that.
Can I just ask, is that the frusemide?
Frusemide,
yeah,
that's right.
I think we're all right if we talk about generic names, but that's quite useful.
Yeah, sure, yeah.
For us vets in the audience, if there are any.
So frusemide resistance is a big thing. I see it a lot, and I don't tend to see these cases of this type of heart disease on day one. I tend to see the guys who have been treated by the vets in practice and done great, and then they improve, and then they're coming down over the hump again and not doing so well. I see them at that point. It's sort of a second opinion or a referral then. And often they're on a dose of frusemide, which is our starting dose. So my first action is to double the dose, or just give 50% more, so I'll just increase the dose, up the dose. And those dogs, 9 times out of 10, a day later, their owners will say, oh, it's fantastic again. Breathing rate.
And that, I think, is what happens. Well, I don't know if you would agree, but that's what happens in my experience with heart failure dogs, is we sort of you just take one little step down and then you match it with the meds, so they get a bit worse like this. And it is just about changing the doses, figuring it out, getting them back on the straight and narrow.
Yeah.
But
there can be a little tweaking when they've had one of these humps, where we tweak the drugs a little bit and then we maybe adjust the dose of something else. And also it takes a little patience, because the first hump they go over, we increase the frusemide. They feel good again the day afterwards. The next hump, a few months down the line, we need to give them a bit more frusemide, tweak a few more things. That might take them a little longer to get over. So I find that difficult, because actually I think one of my personality traits is that I want a fairly rapid response and a rapid answer to what's going on. And sometimes we just have to tweak it, sit on our hands for a few days and wait for the drug to have time to work effectively. But again, 9 times out of 10, it does.
Yeah. How often should people bring their dogs into the vet? So I mean, obviously from a repeated medication point of view, we need to look at your pets in order to be able to prescribe for them. And generally that's once every 3 months is probably about average. Are you happy for our cardiac patients to continue on like we would do our arthritis patients or our hypothyroid patients and stuff like that? Do you think it's beneficial for them to come in more regularly to see the vet? Or now we know that monitoring resps and things at home is okay, is actually home monitoring more effective than us listening?
I think home monitoring is much more effective because, you know, sometimes you can have some additional sounds from the breathing, which may confuse the listening with a stethoscope. And actually, if that's the case, I'm always going to believe what the owner's reporting from home, if they're monitoring breathing rates, and especially if they've been doing it for a while, so they're really confident with it. So my callback is not, you know, more frequent than your average dog with arthritis or, I don't know, high blood pressure or skin disease or whatever. It's just that if the breathing rate creeps up, that's a callback. Rather than anything else, and then just standard prescription checks is what we'd need.
So that's really cool. So this is one of those real diseases where the input from you guys at home with the dogs with the heart murmur is so important, and you can impact so hugely on your pets.
I genuinely believe that since I've been getting owners to monitor the breathing rate more proactively, more frequently, I think these guys are living longer because I think we're getting on top of these humps in the road much sooner than we were before, because the owners are saying, well, I know my dog and he's not quite right. His breathing rate's 28, but he's not right. Okay, well, even on the telephone, I might say, you know what, just give him a little bit more of this or tweak the dose. And then they can do it over the telephone sometimes without even having to bring the dog in. So I think for me, it's made a big difference to quality of life for the average dog to have owner buy-in to this and owner control over situations. So I really, as you say, I really believe it's this teamwork which helps the dog. It's not us as a vet saying this is how to do it, that's the rule, go by the textbook or nothing else. You know, it's a real conversation because I think ultimately owners know dogs better than we do, of course. And therefore their input, you know, we couldn't do it without their input, you know, in terms of managing things. So it's got to be that communication. This
is a real partnership disease. Okay. So we're on these meds. It is a gradual process. We are going to get steps down in the road, but we can match those and we can tweak the meds and we can make sure our patients and your dogs have an amazing quality of life. But this is often a disease, isn't it, which is terminal, and eventually can't manage that. So without wishing to sort of end on a depressing note, but I think it's so important to discuss, how do we know, what signs are we as owners looking for to know that it is time to not tweak the meds anymore? It is time to say goodbye and to euthanize, because that life quality has dipped to the point where it is no longer good enough.
Yeah, it's really tough, isn't it? Because, you know, often, I mean, obviously the owner has the bond of a family member with these dogs, but also most vets have got to know them very well over the years of monitoring them. And it is years from the first time the heart murmur is detected. You know, the average time before they show signs of heart failure is somewhere between 5 and 6 years. So we've known these patients a long time. We've monitored them. We've spent time with them. So it's a really tough situation for everybody. What's quite useful / important to know is that actually probably about half of dogs with mitral valve disease will actually just die suddenly. And that's something that was quite revealing to me, because I think many vets don't see that. They just hear maybe down the line, oh, it's really sad, you know, Fluffy passed away. And everyone says, oh, goodness, you know, I hope everything's all right.
Dying at home, curled up in a heart attack style suddenly. Oh, yeah. Right. That's really interesting.
Yeah.
I didn't know that.
Yeah. And that's okay. I mean, most people don't. It's some research by one of my colleagues, Melanie Hazel, who's got a very, very strong interest in the sort of natural history genetics of this disease. And she published some research a number of years back, which suggests about 50% of these dogs will just drop dead at home. And actually, that's quite shocking, I think, as an owner to hear that first off. But my experience of when that's happened is owners have said, it was horrible, but I was happier that way.
And are they going into
well and then just died suddenly, and it wasn't a sort of suffering or a long drawn out process.
So these dogs aren't going into like sudden onset end stage heart failure, which is quite unpleasant, you know, horrible breathing, really struggling. They're literally strings on a puppet for these guys.
Yes. And actually that may be what it is. It may actually be the support of the valve actually breaks and they just go and they don't know anything about it. It's so quick.
Which is, in some ways that's a good way to go. If you're going to go, that's a good way to go. But I think that's really interesting because, like, I wonder how many patients I have just genuinely lost to follow up, because that's something that I tend to see my heart patients at that more drawn out stage where we're trying with the meds and it's not.
What we remember, isn't it, as vets? We remember that process of, let's try this. Oh, it's not working so well. Let's get some advice from a cardiologist. Let's try a bit of this and see if that helps. Of course, that sticks with us. So I think that's why most vets think that's what happens to all of these dogs. But actually, it happens to about half of them.
Now, interesting. Thank you so much. But so for the other 50%, it is that his breathing just isn't improving. They're no longer able to manage more than to the bottom of the garden and back before they're completely out of puff and breath. And that's a much, much harder decision, isn't it? But if going out to the toilet is too much and we can't improve the heart function beyond that, then that's probably the end stage for a lot of our other patients, isn't it?
Yeah, it is. I think the way that I try to look at it is how much of a return are we getting in terms of quality of life for each change in the meds. So each tweak, 6 months ago we put the dose of the furosemide up and he was better again in 3 days, exercising great. The owner said, oh, you wouldn't know there was a problem. And then this time around, maybe 2 weeks ago, we had a drop off again. So we increased the dose again, maybe change the drug to a different diuretic. Sometimes we do that, and that again can make a big difference. But the owner says, he wasn't as good, but he was okay for 2 weeks. And now he's back where he was again. We're seeing this diminishing return. And I think when it becomes diminishing return, we've got to have a serious conversation about where we draw the line. Where do we call it a day and put them to sleep? And I know that's difficult. I've had the experience, of course, as a pet.
It is so hard to be objective. It is so hard. And that's where things like, from my perspective as a first opinion vet, I think quality of life scoring and diary keeping and that sort of thing is really important. But
super important. Before
that point, they've had a great quality of life. They've lived for years and years and years. So I think we were only supposed to, I said to Kieran when I said, Kieran, it'll just be half an hour. We'll just chat for half an hour. It won't be long. Anyway, we've nearly been at this for an hour now. So
I'm sorry.
Well, I just think it's really, really interesting. And I hope everyone who's watched and stuck with us this long has really enjoyed it as well. And I think I found it helpful. But the message, the take home message that I really want people to take home from today is that when your vet says, whoop, they've got a heart murmur, that is not panic stations. That is not floodgates to loads and loads and loads of testing and intensive care. That is not a death sentence. That is something that we can have a massive impact on, that we can keep their quality of life absolutely brilliant, that we can, they look good to you, they are good, and we can keep them good. And having a heart murmur does not mean heart failure. And even when heart failure develops, we can do something about that as well.
Yes.
How would you? What message would you like as a sum up for these patients? What do you want people to know?
So I think the important things for me, if your dog looks well but has a heart murmur, it is worth imaging the heart, X-ray, ultrasound scan, for sure, because then we can identify if we can bring them benefit from the treatment. And that treatment buys them, on average, more than 1 year. The other statistic that's useful is that if your dog looks well and has a heart murmur, 50% of the time, those dogs will never progress and never need any medication at all. So don't panic, but do act.
Fabulous. Don't panic, but do it. I like that. I shall save that for the next one. Right, Kieran, thank you so much for joining me. I'm really, really grateful. We've had lots of really great comments, and I know people will come and watch it again. Thanks again to Boehringer for sponsoring us. Go and check out the Beat website. It is genuinely very, very good. It's got loads of really great explanations and videos and recordings of heart murmurs and that sort of thing about all sorts of different breeds. It is genuinely very helpful. And thanks everybody for watching, and we'll see you again soon. Bye.
Bye.